Welcome, everyone. My name is Sabeen Shaikh. I'm with LifeSciences Consultants, and I'm very excited to be here to moderate this panel today. On the stage today, we've got some esteemed colleagues from the industry. Rachel Van Stratton-Kirk from Johnson & Johnson, Bhavesh Barot from Truffle Capital, and Richard Vincent from FundamentalVR. So what we're looking forward to today is to identify the different lenses that are coming into play when it comes to the immersive VR AR opportunity in the surgical theater and operating room. The opportunities that we have today, as well as the tailwinds and what we are looking for in the future. My role with LifeSciences Consultants, I oversee the global medtech practice, working with strategics and investors. We work with a number of different companies with deep domain expertise in a number of different areas, including the AR/VR space. I'm going to hand it over to my panelists to do an introduction of themselves before we get started with the panel. Richard.
Thank you. Pleasure to be here. I'm Richard Vincent. I'm the CEO of FundamentalVR. Our focus is in the use of spatial computing and VR for acceleration of skills and knowledge. So in the training field ahead of VOR.
Thanks, Richard. My name is Bhavesh. I work for a French VC company called Truffle Capital. And Truffle Capital is an atypical VC company, more of a venture builder that builds companies from ideation and then takes them all the way through to commercialization. And prior to that, I was working in Medtronic for 17 years and had exposure to several of the technologies there as well.
Rachel Van Stratton. I'm part of Johnson & Johnson Global Strategic Marketing. I have a focus on our robotics and digital space. And I manage the strategy for our advanced visualization portfolio.
Thank you, everyone. I'm going to start off with Richard here. Richard, what are some of the the headwinds that you're seeing from your perspective on the innovation side?
Sure, and it's a pleasure to be here, so thank you for bringing us onto the panel. As I said, my focus is very much in that pre-operative training, education, and skills transfer piece. What we're seeing really, I guess, in terms of headwinds is probably two areas. So the first is, the macroeconomic environment that we've been living in the last 18 months. Our customers are people in this room, medical device, pharmaceutical businesses looking to accelerate their product adoption. And there isn't one of those organizations that hasn't had a major restructure, moved a lot of people around or out of those organizations, restructured their budgets, thought hard about how and where they spend. And as a result, innovation comes under the spotlight. And in some cases, that's meant perhaps a slower move into this space than we would have otherwise have expected to see. Part of that's because of financial constraint, but more it's, I think, to do with human nature, which is, again, back to those individuals in those organizations, having gone through those types of changes, the idea of lifting your head above the parapet and saying, okay, I want to do something different. We've used wet labs, cadaveric labs for this skills transfer for the last 20 years. I think I'd like to do something different to that. And I'd like budget to dual run and prove that is quite a hard thing to do. And so I get that there are a number of people who perhaps have pulled back from standing up and saying, actually, judge me on a completely new approach. There are, of course, innovators out there, but a number of them, I think, are affected by that. So that's the first one. I think the second one for me, really, in terms of headwinds, is what I call kind of the trough of disillusionment in immersive tech or spatial technology. And that is that there are a number of organizations that have done a bit of testing, tried proof of concepts, perhaps tried the implementation of VR in my space with a number of different organizations. And what they found is two things, really. Firstly, perhaps the simulation that they have tops out quite quickly. And so its use with their customer base, with their healthcare providers, runs out quite quickly because it doesn't go far enough. And secondly, what they've discovered, probably this is the most fundamental one, no pun, is that having an app is just the beginning of the journey. The organizational change, the logistics around actually managing that and making it impactful for the business is quite a big task. And that's one that we've certainly had to support quite heavily.
One more question related to some of the headwinds that you're seeing. What about from the funding side? Because I recognize that we've got an investor here on the panel. I'm curious to hear about any challenges that you've had in that space or that other startups in your area would have.
Sure. It's always an interesting cycle, isn't it, to the ebbs and flow of the investment mentality. And there was, when I started our business 9 years ago, there was immense excitement around VR, probably kind of 2 years in, when people were starting to understand what the potential might be. That, like the Gartner hype cycle, kind of fell off a cliff at a certain point. People got a bit bored and stopped believing. Recently, with the advent of people like Apple coming back into spatial computing, that started to reignite interest. I think what we're seeing is that the investor base believes in the end game of spatial computing in medical. They're just not sure about the pathway between today and that end point. So it's about trying to give that substance.
Thank you for your insights. I'm curious to hear from Rachel what your thoughts are on the headwinds for this type of technology and some of the things that Richard had just mentioned.
Yeah, I think for us, as we are looking at AR and VR, we see there are a lot of applications. I think to Richard's point, it's questions of will the customer adopt using that technology, and depending on what it's for, will they be open and welcome to it? I think you find it's a mixed bag with digital, especially with our customers who are surgeons, first assists, hospitals. How will they accept that? I think it's starting to really gain momentum, but then I think from our side, sometimes it's hard to find the right partner, meaning that they do specific niche things, right? So you may not find someone who can do multiple applications. They may be very focused in a specific area. So I think for us, having someone with broad applications or broad abilities to meet multiple different VR potential needs, and at times feels like a headwind for us because it doesn't always feel like one partner can do them all.
I'd like to come back and touch on a couple of things that you mentioned related to the adoption as well as the fragmented nature of this. But before we do that, I'd like to hear from Bhavesh what some of the headwinds are that you're seeing from the investment side.
Yeah, I think I think everybody in the room knows one of the biggest headwinds is getting access to capital in today's climate. When you've got difficulty getting access to capital, and it's a buyer's market, you've really got to have some strong justification. I would say today, and Richard, thanks for schooling me and sharing me some of the literature last week as well. But I don't think it's that prominent in terms of the literature that supports the real world evidence, as we were talking about, in arguing for the case there as well. So to be able to advocate for an XR VR solution, to really see the value and the benefit from it, you need to pass through a series of checks. And as an investor looking at identifying potential investments, you're going to check through in terms of the technology. Does the technology do what it says? Do they have the right management team to be able to go and realize those dreams from that standpoint? Do they have the ability to get a exit? And today's climate, it's got to be a shorter exit window there as well. And then what's that protection around this as well, from an IP standpoint? And I think these are all some of the challenges there as well. And I was sharing with Richard, in my former days in Medtronic, we would use the XR and VR headset, and I liked the term you used as stand candy, right? So we would have it on the booth to attract surgeons or physicians to come over, and then we'd start engaging in a dialogue and a conversation with them. And that's what it was for. But how do you operationalize it as well? So I think there's an opportunity to change that potential misconception and really realize it. And I know we'll talk about the tailwinds in a moment, but I think that's where we stand today. What's the proof of the technology? Can it really work? have you got the right team and then people backing it? Am I going to be protected if I make an investment? What stops, somebody else copying what Richard's done and spent years designing? And then how quick am I going to get my money back for this as well? And these are all the challenges or the headwinds that you'll face today and in the future as an innovator.
Thank you. Actually, I'd like to piggyback off of that before we go back into the adoption opportunity. Rachel, when it comes to some of the points that Bhavesh has just made related to what type of data is supporting this, what are you seeing from the industry side of things or strategic side of things?
I think to his point about we always bring people in, it's exciting, right? It's a great way to get people looking at your technology, talking about it. But then on the flip side of that, can we use it for training? Can we use it for potentially troubleshooting? Can it be used in a kind of a communal effort in which we're calling in people from other countries and asking, surgeons can actually do like a telepresence with it. Those types of things. So I think from his where he's going with that, is that something that people are really going to be like, hey, this is worth my time to step away from what I'm working on and bring all of this into light. Let's go get the headsets. Let's work on this. There's still questions about that workflow, right? And whether or not surgeons and hospitals and the people that would be involved in using this are really willing to do those things. I think training is a whole other thing, right? You can definitely walk through training, but to use it in kind of an everyday practice, depending on the applicability, I think for us, that's where we're still a question.
So I guess going off of that, with the workflow, I guess opportunity there to fill the gap in, the question for you is that how does that impact the adoption?
Oh, we always know if it impacts workflow, there is no adoption or it's minimal adoption. So that's a guaranteed, and that is always something whenever we're investing and or looking at technologies. If it breaks workflow, if it doesn't, and I don't want to use the words doesn't add value because there are a lot of these things that add value, but when the surgeons are very strapped for time, they have to get a certain number of patients in that day, the ORs are full, those kinds of things break workflow and they slow things down. And they will just say, I just don't have time. Maybe if I have a lighter day, I could use something like that. But if it breaks their workflow, it's a game over.
Richard, out of curiosity, have you found a way to address some workflow opportunities maybe now or in the future with your technology?
So the point that Rachel was talking about, we're not in that intraoperative connection. And certainly, as I talk to surgeons about the use of spatial in that space, it feels at the moment like it's still we're still looking for the killer app. Mm-hmm. And there's compromises in workflow, there's compromises in vision quality. Some of those are starting to get fixed, but the workflow one is the big one. Have we solved it? We haven't. No, absolutely not. I'm not sure how you do that. Again, you're starting to see in some of the tech the capability to solve some of the other shortcomings. So the vision quality of the new device coming out from Apple, for instance, makes it a contender for the interventional suite suddenly, and you say, well, actually, you could replace those different screens that are up there, potentially, but the workflow, everybody has to have their own headset that needs to be charged, that needs to be working at the right time in the right way. That's a minefield. Navigable, perhaps, but I suspect that's not an incremental change. I suspect that's a much bigger kind of OR or cath lab of 2050 type conversation where you actually have to reimagine the whole stack. And I'm not sure who leads that.
I can imagine it's going to be from the imaging companies. I was just trying to see if anyone's here from the imaging companies, because I'm sure for anybody who's gone into an interventional suite, especially in a cardiology interventional suite, right? Preoperative, you've got these great softwares, pre-op planning tools. You can see everything in 3D. You can measure the calcification. You can look at all the valves, open them, close them. And then you go into the cath lab and you're driving in fog you're going to this analog black and white signal, and you're unable to even see properly. And it's like, you feel like you need to kick the TV and try and get the picture quality up there as well. So I would hope that the premise of AR is going to come a lot sooner, because it's needed today. And even today in the intraoperative imaging tools, there are tools that are already out there on the market, but what they do is that they take a CT image and MRI image, and then they record them on loop, and then they superimpose them into the cath lab. But what they don't do is do the real-time tracking. And when you're positioning and placing a valve, or you're trying to find the thrombus, having some tools to help you navigate to detect instruments, and then be able to understand what choice of instrument you should use could really change the games there as well. And so I think the headwind is if it's going to disrupt and it's going to cause problems to the workflow, but if there's able to show that benefit and that value add, how you're able to superimpose images and you're able to look around, it could really be a game changer. Because at the minute, as you said, they're looking at 3-4 different images, and that is disrupting the workflow today from that standpoint.
Yeah, I think that's where, to your point, we have the pre-op imaging, right? You can do the 3D pre-op imaging today, but the future state is how do you get that intra-op? You can do external, you can look at better ways for patient positioning, port placement. How do I anticipate, especially like in a thoracic procedure, positioning the patient just right on the table to ensure you're getting to that sublobar lesion, that kind of thing. Super, super important. Can we help provide port placement options? I think those are all things that we know are available to us today. It's that next step. How do we get into the intra-op space and have it continue to evolve as well as provide value? But, there are still on the front end the opportunities just around training and around being able to get people used to utilizing tools that you have available for them without always have to have those tools right there. And I think that's where there is a lot of value to getting ready or preparing for procedures, having the OR staff well prepared, well trained through just even a preoperative like VR space.
Thank you. One of the things that you touched on, I think we could probably look into from the Tailwind side of things as a future opportunity, predicting the workflow. So I guess going into now the next section of the panel discussion is the Tailwinds. So I'm curious to now hear from, let's start with you, Bhavesh. What do you think some of the tailwinds could be for this type of technology?
Sure. Start with the quiet one first. That's a good one. Yeah. I've got to put a coin in me. I won't stop. I think the tailwinds for sure is what's happened in terms of the pandemic, right? Where people like us have chosen whether we're going to travel the extra miles, whether we're going to go out of our zone, whether we're going to go out of our facilities to go out and then train. And then also, it's impacted the skill set as well. And, I think one of the things that we were talking about, Richard, as well, there are more and more residents coming through. And if you speak to a professor or one of the trained physicians out there, they're always complaining, saying that, these new youngsters coming up don't have the same hours, they haven't worked as much, and they're not adequately equipped to actually manage some of these complex cases as well. And so, the challenge that presents today is that, you've got a group of residents that are coming through, you've got a shortage of staff, and then, you've got these restrictions in terms of, and I'm pointing at you, but I'm saying for the strategics, which is, hey, we need to cut costs, we need to drive profitability, we need to be working more productive and more efficient standpoint. And all of these things, especially from a VR standpoint, are, perfect opportunity as a tailwind there as well. And so that's where I see great opportunity there. You referenced Apple, and I'm sure, majority of us here in this room all have an Apple. And guess what? When Apple does something, people are going to do it, even if it costs is it $1,500 for the Vision Pro? Is it?
It's more like 5,000.
Oh wow.
Time
Okay,
order.
but it doesn't matter. You'll do it, right? And so you'll get physicians, ourselves, that want to put it on. And I've already seen several strategics that have said now they've created softwares. There's an API there, and so that's going to be a great tailwind there as well from a technology standpoint as well. So I think you talked about the macro environmental standpoint. You look at what's happening outside in terms of limited resources, not enough hours in the day. We need to cut costs. We need to be more productive. We need to be more efficient. You're seeing this shift in terms of technology, and I think for VR, I think that could be great. And then I've already shared from an augmented reality standpoint, there's a need today to be able to capture this and to enable the physician and see more than the human eye can do. And that's what's the opportunity with AR, to be able to go and do that.
Richard, I'm curious to hear your thoughts on some of the tailwinds and a couple of the points that Bhavesh had mentioned as well for the opportunities.
Sure. I guess it's the flip side of what I said was the headwind. So you need the proof points, right? If you're going to stand up and say, actually, I believe I can do this, we can make a difference, whether it's intraoperative or preoperative or training in our use case. Surfacing those proof points is key. And that's hard because every strategic sees that as a competitive advantage. So putting them into broadcast is a difficult thing. But they're surfacing, okay? We're seeing it. We're seeing impact on sales. We have customers who are reporting back to us 20% increase in sales as a result of using our platform in market to accelerate the adoption of their product because they're getting people there faster. We're seeing reduction in cost. We have people on our platform who are reporting 50, 60% reduction in the training costs because, quite simply, they're not putting teams of 8 people on a plane and housing them for a week in an environment to go through 4 cadaver labs. It's just not happening now with some of those scenarios. So we're starting to see those things. Of course, we've all done it in our space. We've all spent and invested the time in validation studies to prove efficacy. But real-world experience is where the business case is built. And those are starting to come through. And my job is to try and convince our strategic customers to allow us to surface those with specific information attached to it. Because that gives you, Rachel, confidence. Then you go, really? So 20% up, more sales? That's right. Got to market 6 months earlier? That's right. Reduce costs by 25, 40, 50%? That's right. That's when you go, okay, I feel confident. I'm going to get up now and go, yeah, we need to do this differently. Because again, the tailwind is there, but you're going to have to do some dual running. You're not going to say, right, get rid of the old way of doing it, and today we're just going to go digital. You're going to run both. So you're going to run double costs for at least a period of time. And so the more I can get those data points in front of you, the more confidence you'll have to say, actually, we need to do this. This isn't stand candy. I hate it when it's on a stand. It's not stand candy. This is an accelerant of adoption of a product. And if it isn't that, frankly, it's a waste of money.
And sorry, if I can, Rachel, there's an opportunity, and this was something I was doing in Medtronic even before a physician would come to your training center in Cincinnati, in Hamburg, wherever it is. It was a prerequisite that they had to go and do some form of didactic training or some form of even online, and there's several tools and platforms that I won't plug for them at the moment that you could go and use. And so we had that as a prerequisite before they could come. They'd already done that. And so that way you can then increase your adoption. And so that it's not people coming because they want to go. I don't know if would people choose to go to Cincinnati on a break? Maybe not. Yeah, but maybe in Hamburg they'd want to go out there and have some fun. And we used to have in Medtronic training centers in France and in Strasbourg. It's nice and pretty. Can I bring my wife along as well? To actually making sure that there's going to be that adoption there as well. And I think that's where, from a VR standpoint as well, if you can make sure that they've done that initial part. And then the last thing before I shut up. Ultimately, you talked about a cadaver, but also there's an animal there that is being used, and ultimately the animal is going to be, put to sleep. So there's an ethical aspect to that as well, where I think the VR piece can really help. Sorry.
Yeah, no, you're good. Yeah, I agree. I think for us, we're seeing massive tailwinds sales, marketing, as always, right? That's a big adopter. Training. Can we use it for broader applications? You may not always get fine skills, right? You may not be able to train the fine skills, but if you can get some of those more macro skills and then get them closer to being on a system to actually, right? I can't drag a robotic platform around from city to city. And I have, in my portfolio, I actually have some tools that we are looking at adding to our platform. Those are hands-on tools, and I'm trying to figure out a way, can I actually turn this into a VR, AR type of an environment to just do market research, right? Because of that workflow. Not the workflow of AR, VR, it's the workflow of actually utilizing this tool that from a front-end perspective and upstream perspective, I want in our strategic portfolio. But it requires me to take equipment all over the world, which is incredibly costly. So I'm looking to see, is there an opportunity just for VR to actually meet market research needs so that I can actually have surgeons get hands-on with a tool that we're developing in order to get the right feedback and not drag 15 Pelican cases from here to Germany to France to Italy. And so that for us, I feel like the tailwind is there for that. Like I feel like we're getting really to that. We've really started perfecting that training area, the interactions with the tool. People are getting more comfortable with it. So now how can I actually have a selfish, need to be able to put this in for market research just to get feedback on the tool itself. But I also can't afford to have that take 10 months to develop, right? So then it's also, how can we get that a little quicker?
Yeah, I think it's good if I come in on that. I think you're absolutely right. I think there's enormous potential there for that R&D part of it. I think the other thing though is, again, it's staying in your space of robotics. We've seen it where there's a learning curve, right? So let's say it's 50 cases to get proficient. Mm-hmm. If you have to do that on the console, right, using simulation, backpack type simulation on a console, then as a physician, I'm probably at the end of a 12-hour shift, I'm then being asked to go and spend an hour or two sitting at a console in a sim center or in a dark OR. It's not great. Whereas if you can take that home with you, right, and go, well, actually, I'll crack into that for a couple of hours, maybe today, maybe tomorrow morning, at my convenience. Mm-hmm. You may not get perfect replication, but if you get near perfect replication, and we can get pretty damn close these days, then it's on your terms as a practitioner. You start to say, well, actually, I can get in 20 reps, 30 reps, right, and then come to the cadaveric session or come to the wet lab and conduct the things there. I'm all for saving rabbits, right? So let's yes, rabbits and pigs, we need to save lots of those. So we can help a lot on those things.
Bhavesh, I'm curious to hear from your perspective, given some of the comments that you made related to the tailwinds that you're seeing from the investor side and the data points that you need to see to put more money into this type of technology, and then hearing what Richard has said about being able to improve top-line revenue, reduce bottom-line costs, and then hearing from Rachel as well on what some of the opportunities are within the strategic side of things. How does that change your mind, if at all, from the investment side of what the data points are that you need?
So I think, typically I mentioned, during the diligence process or even, the initial sort of deal flow process, we'll have various sort of checks and balances, and you'll go through those stage gate questions to go and see if that technology makes sense. But as part of that diligence process, typically what you'll do is contact one of the strategics as well, and that will be now in today's climate, several of the strategics, to see how likely are you to go and perform, leverage this technology. And it depends on how the acquisition would be, but ultimately the goal would be an exit to one of the strategics. We'll also combine that with some voice of the customer. I think in the previous panel they talked about GLG, using them for quick questions and getting a finger on the pulse. But if you had a value proposition that said, it could significantly improve the workflow, it could generate revenue. It can have a low-cost model, something similar to what Richard does, where it doesn't require a significant cost of capital, where you could monetize it and you could go and get that subscription business and that repeat business. I'm sure for the right investor, it would be interesting, but you know, depending on their portfolio and their timing of their fund.
You touched on something that a lot of investors talk about would be the subscription model, right? And I think that what we're seeing is that there's a lot of different revenue models that are set up with this type of technology. So I think I'm curious to hear from each of you, what are the things that you're seeing most frequently with this type of technology?
Should I go first?
Sure.
Yeah, so subscription model is certainly the route that we prefer to go. Not all of our customers are ready to buy that way yet. And I think it depends in which part of the organization you land as well, in terms of their readiness to go there. So we have some pretty robust discussions with procurement about why you don't want to own this. You actually want to subscribe to it, but sometimes we have to give way on that one. But I think it is the way forward, not because it works from an investor standpoint, although it's good for the business. Obviously, recurring revenue is a great place to be. I think it works because the pace of change that happens in this technology is such that actually, if you buy a 2024 vehicle, it's out of date in 2025. Whereas if you subscribe to a plan that says actually you're always going to have the latest vehicle, then you've got a much more equipped solution. And I think that's the way people need to think about it, certainly from my perspective. But like I said, not everyone's ready to go there yet, so we have to ebb and flow on that one a bit.
Okay. Rachel, what type of models are you working with within J&J for this type of technology?
Yeah, I think it truly depends on the application. You know, from a training perspective, that's going to be on us, right? That's going to be our cost, our capital investment. I mean, of course, if the hospital wants to purchase one in order to continue ongoing training, then yes, you're looking at subscription type models where you continue to update the training and software and things like that. I think this continues, as with a lot of digital today, is the age-old question of how do you monetize it? And that is where we continue to really try to understand, because it's again like a chicken and an egg. Like, if you want people to be willing to try it, you also have to let them have it at either a nominal or no cost in order for them to uptake adoption. But then when you go back and try to charge for it, then they're like, but wait a minute, you gave it to us for free to start. So it is a chicken and egg problem when it comes to digital of any kind in how you are able to monetize. And I think right now subscriptions are the best way to go. But then the question is do they purchase the capital? Do you ask them to purchase the capital and then they pay for a certain amount of software upgrades? And how do you do that to maximize not only your ROI, but your customers' willingness to buy and to continue to subscribe?
And if I can add, I think in a strategic that's traditionally used to selling devices, it's a different skill set and muscle to be able to sell software as a service as well. Yep. And you know, I think several of the strategics have struggled there as well. It's like, what do you mean we've got to sell it? How are we going to sell it? And it's a different muscle, it's a different skill set. And maybe you want to share, you know, the kind of people that you've brought on in your teams as well, to be able to help you in that journey.
Yeah, I think there's as you say, there's a different skill set there. So you have to educate and then drive that message through. But I think what's interesting for me is occasionally we'll have somebody table the idea of can we build a financial model that's based on the outcome, the impact, whether that metric is about devices, numbers of devices going through, whether it's about cases. Yeah. And I'm always really intrigued by that, because actually being part of that conversation, the end point is a fantastic thing. We've not managed to take one of those to conclusion yet. They've all fallen over in the process, but I'm all in on that one. I think we want to have that major impact and see and share in that. Again, I think at the moment, a lot of the buyers of this technology, whether it's in my space or whether it's in the intraoperative space, are finding it hard to account for that type of approach, which is why I think we've not got there yet, but I hope we will in the future.
So I recognize that we're nearing the end of time, and before we close up the panel, what I'd like to do is allow each of the panelists to leave us with one statement, something about their perspective, a thought that they have related to this technology from their lens, and something that would be, you heard it here first at LSI. Richard?
Up first? Okay. I did get a heads up on this one. So I think that the leave behind for me would be this, from my perspective, this isn't about simulation, this is about virtualization. And by that I mean taking the logic of the devices, of the equipment, and virtualizing it in a way that means that you're not just practicing, you've actually got, to use the flight analogy, you've got true flight time. You're flying the actual device in a virtual space. That's where I think the future is in the space that we're operating.
I think in today's climate, the strong will survive. And when I say the strong, it's going to be the strong value proposition, it's going to be the strong evidence and the strong data, it's going to be the strong offering, the strong management team as well. And if you have that winning solution, then you're going to be able to go out there and still continue to thrive within this environment. Within the VR and the AR space, we've talked about it, but sort of going beyond the stand candy and going beyond the gadgetry aspect, which is still great. Don't misunderstand me, right? It's great to sort of pull people over to your booth, but you're not going to be able to convince leadership to go and acquire a company or spend hundreds of thousands of dollars. So I think there's a need to really show that, and we've talked about it a few times, but really making sure that you're able to quantify and monetize this opportunity from that standpoint.
Yeah, I think for this, it's as we've seen it progress, it's the continual evolution of it and how it continues to get better. So I think each year we see more applicability in this space. And for me, I think it's watching it continue to evolve, but supporting it along the way, because we can't just always wait for it to be the best of the best. There is going to be points, where we started a few years ago versus where we are today has had huge leaps and bounds, right? We've got much more usage, much more applicability, much more adoption out there. So as you start moving into the next phase of that, I think you're going to start seeing more adoption, but the technology has to also continue to improve, right? It can't just be about adoption. It has to be the ongoing improvement, as well as the broader applications. For us, it's being able to use it more broadly.
Well, that's our panel for today. I'd like to give a round of applause to our panelists. Thank you for your time. And of course, you can hunt any one of these three panelists down if you've got further questions. Thanks.